There was a recent conference that we're talking about, and it covered an urgent healthcare concern that we are only now uncovering ways that medical professionals can better serve these patients. The topic is cryptogenic stroke, and this is the first time findings have really been presented on this topic. You have a group of scientific and medical professionals collaborating to improve ways to care for patients. And this happened in September, and so to talk about this, I want to talk to Dr. Ann Bauman, who is an MD, INTEGRIS Family Care Central in Oklahoma, and where you're the medical director for Women's Health and Community Relations, and that's Oklahoma City in Oklahoma. Talk about this, because cryptogenic stroke is something we've heard about before. What was different about this conference?
I think what we're trying to do is raise awareness of cryptogenic stroke and trying to determine the appropriate protocols so that everyone, wherever you are in this country, will get the same evaluation, because what we'd like to do is take cryptogenic stroke, which means it's a stroke of unknown cause, right, and turn it into a known cause stroke. And so that was to raise awareness. So we find that physicians and patients don't really know this term. People don't know what cryptogenic stroke is. And so by raising awareness and standardizing protocols, we hope to make a dent in this.
So you really were bringing some people together, scientists and doctors who don't usually talk to each other?
Well, we were bringing public health officials there. We were bringing physicians, scientists, researchers, everyone together to try to really brainstorm about what is the best approach for this and where do we go from here.
So where do we go from here?
I think our first step, we're working with Medtronic, who is our sponsor with this, and our first step is really to start to spread the word. We have a patient support tool, we have a physician support tool to really start to understand. Lots of times people, when they've had a stroke, they leave the hospital or the rehab facility and they're not thinking about all the questions they should be asking or thinking about. So this patient support tool will help to give them that information so that they know what questions to bring to their doctor, and it'll be helpful for doctors too to know what sorts of evaluations we have to make sure we're done on this patient to try to determine the cause.
So what was the exciting thing for you in this meeting? I mean, this was kind of a first to get these people together. What about it got your attention? Like, finally!
Yeah, I really think the exciting part of it was, first of all, the presentations explaining what cryptogenic stroke was and what kind of etiologies really we do find for the stroke. And then secondly, with all the public health, we had people from federally qualified health centers, from community clinics, their interest in say, yes, give us this information. We want it, our patients want it, and we think it's going to lead to much better outcomes.
And what should clinicians know at this point?
I think clinicians should know that we have to make sure we have done an exhaustive evaluation to find the cause of the stroke, because the most common reason, the biggest risk factor for a stroke is having had a stroke before. So by trying to find out what we can do to help to avoid the next stroke is the most important thing for the clinicians.
Now, is there information online that you would like to talk about?
Well, we do have our support network, which is available online. You can go to the American Heart Association, American Stroke Association.org and get that information. That's for the patient support tool. We want everybody to begin using that. And then we'll be doing webinars with physicians and continuing the education process with physicians as well.
Ideally, in 5 years, what would you like to see?
I would really like to see that instead of 20% of strokes being cryptogenic, unknown cause, we get that number down to below 10%, so that we can really know what caused this event and so that we can avoid the next one.
And the hang-up right now is it's less that we don't know, it's that we don't have the time to find this information out, or we're not doing it correctly.
I think we don't. Number one, we're not always looking for everything. You know, the major causes of unknown cause would have something to do with something anatomical in the heart, would have something to do with somebody who has a thrombophilia, they clot more frequently, or an arrhythmia, whether that be atrial fibrillation or some other irregular heartbeat that is causing the clots to form and then can get up to the brain. So really finding the reasons for it, because there are treatments for those that we can make a real difference.
Well, we couldn't make it to the meeting. We had a conflict with another meeting, but I want to thank you very much for finding us here at the AHA meeting. And you gave us a URL. Please go get the information from our friends at the AHA. Speaking of which, this is the 2015 meeting. Our coverage is in CardioSource World News, where I'm Executive Editor Rick McGuire.